Good evening. This is All India Radio Kohima. I'm Jonas Yantan with Evening News. The headlines. Nagaland Legislative Assembly discusses Nagaland-Assam border issue. Nagaland Health and Family Welfare Minister S. Phom says government has taken timely steps to respond to the second wave of COVID-19. Minister for Higher Education Temjen Imna Along says new model degree college, Wakching, will start after government gives sanction. An Indian men's hockey team defeats Germany 5-4 to win bronze in the Tokyo Olympics. As the nationwide free COVID-19 vaccination campaign at government facilities for those above 18 years is going on, we advise our young listeners to get vaccinated and also to help others get vaccinated. We also advise our listeners not to lower their guard as COVID-19 remains a threat to our health. Please stay at home unless it is essential to go out and continue to follow these 3 simple steps. Wear a face mask, maintain 6 feet for social distancing, focus on hand and face hygiene. For any COVID-related information and guidance, contact national helpline numbers 011-2397-8046 and 1075 and state helpline number 1800-345-0019. And now the news. Nagaland Legislative Assembly today discussed at length on Nagaland-Assam border issue initiated by MLA Imkong L. Limjin as a matter of urgent public importance. Members from both the ruling and opposition were of the opinion that Assam government has become too aggressive and has been flaring the border tension not only with Nagaland but other northeastern states with whom Assam shares border. The members opined that Nagas have been immensely suffering because of the unwarranted situation created by Assam side along the border areas, while also forcefully occupying lands belonging to Naga people, crossing beyond the demarcated areas in the disputed land. The House unanimously adopted a 3-point resolution on Assam-Nagaland border issue through voice vote. Parliamentary Affairs Nipa Krono initiated the discussion on post-COVID-19 economic recovery. 2 government bills on Nagaland professions, trades, callings and employment taxation, 5th Amendment Bill 2020, and the Nagaland Lokayukta Amendment No. 2 Bill 2021, moved by Chief Minister Nipirio on August 3, were passed today. Deputy Chief Minister Y. Button laid a copy of the report of the Commission on RIN in fulfillment of the assurance given on the floor of the House on August 3. Chief Minister Nipirio presented the report of the Comptroller and Auditor General of India on general economic and revenue sectors for the year ending 31st March 2010. During the question of Wakching water supply, utilization of funds for COVID, Vaziho-Molen Road construction, works program under roads and bridges, status of Kohima B-Pass, package 2 of Merima, and others were taken up. NLA Speaker announced the revised composition of the various financial and non-financial committee for 2021-22. Later, the House was adjourned sine die. Nagaland Health and Family Welfare Minister S. Phom today said government has taken timely steps to respond to the second wave of COVID-19. Giving a statement on the floor of the House, Pangnyu said government has ramped up the bed strength to 1,153, which includes 296 beds without oxygen support, 669 beds with oxygen support, 99 ICU beds without ventilators, and 89 ICU beds with ventilators. Pangnyu said government is building a 200-bedded hospital with 24 pediatric beds for acute medical care at CIHSR in Dimapur, which is likely to get operational by September. He said government procured nearly 6,000 oxygen cylinders having storage capacity of nearly 17.5 metric tons. Pangnyu informed that PSA oxygen generation plants, along with oxygen piping and generator backup, have been installed at Kohima, Dimapur, Wakching, Twensang and Peg to ensure availability of bedside oxygen. He said a state procured or received through various sources oxygen concentrators, and more than 2,000 concentrators are deployed at various medical facilities. Pangnyu said out of 688 ventilators, 239 have been distributed to various health facilities, including private hospitals. The minister said that besides the 3 BSL laboratories, government has also established 25 TruNAT and 362 rapid antigen testing facilities for COVID-19 across the state. Pangnyu said government launched mass COVID vaccination drives as it is recognized as the most effective tool in prevention of COVID infection. He said the state has administered a total of 7,67,535 doses of COVID-19 vaccines as of 30th July 2021, covering about 49.3% of the targeted of first dose and 12% for the target of the second dose. Pangnyu said no serious adverse effects due to COVID vaccination have been reported in the state. The minister informed that out of the 463 COVID deaths as on 30th July 2021, only 2 cases of death occurring 2 weeks after the second dose vaccination were reported. Stating that the virus has not gone away, Pangnyu emphasized on the need to be cautious and not lower guard. The minister said government will continue to work to cover the entire population with vaccination. Pangnyu also placed on record the efforts being put in by the faith-based organizations, civil society organizations, village authorities, elected representatives in fighting this pandemic. Pangnyu said healthcare workers and frontline workers, both in the private and government sectors, have been at the forefront and have put in their best efforts. This news comes to you from All India Radio, Kohima. You can also listen to this news bulletin on a YouTube channel, AIR News Kohima. Minister for Higher Education, Temjen Imna Along, said the department will be in a position to start the first academic session at new Model Degree College, Wakching, Andamon District, only after the state gives sanction, approval for creation of the proposed minimum required post for appointment. This was stated in a start question raised by MLA YM Yulo in the Assembly session today. Minister Along said, based on the urgent need to start the academic session for the new college, the department has submitted a proposal to the state government requesting for creation of 69 posts. He said the process of post creation have already started but put on hold due to the COVID-19 pandemic. He said the department is working for further submission of the required information to the state government. Minister Along also noted that a request made by MLA Yolo for post creation on special category so that academic session may start by next session. Nagaland today reported 118 fresh COVID-19 positive cases, increasing the tally to 20,304. Dimapur reported 36 fresh cases, Kohima 27, Zunapura 20, Mokokchung 13, Tuensang 5, Beren, Pek and Woka 4 each, Kifre and Longleng 2 each. Total COVID recovery in the state has gone up to 25,603 with a report of 87 recoveries today. 2 more COVID deaths were reported today, taking the COVID toll to 567. Indian men's hockey team scripted history with their sticks as they defeated Germany 5-4 to win a bronze in the Tokyo Olympics. The quest for medal for India ended after the wait of 41 years as men in blue outplayed Germany in every quarter in a high-scoring match. For India, Simranjit Singh scored 2 goals and Harmanpreet Hardik Rupinder Pal Singh scoring 1 goal each. Overall, this is 12 medal in hockey and 3rd bronze for India in Olympics. Prime Minister Narendra Modi congratulated the team for emerging victorious and bringing home the bronze. Vice President M. Venkaiah Naidu and Chief Minister Nipurio have also congratulated the Indian team for winning bronze medal in men's hockey at Tokyo Olympics. And now to the news, here are the main points again. Nagaland Legislative Assembly discusses Nagaland-Assam border issue. Nagaland Health and Family Welfare Minister S. Phom says government has taken timely steps to respond to the second wave of COVID-19. Minister for Higher Education Temjen Imna Along says new model degree college, Wakching, will start after government gives sanction. An Indian men's hockey team defeats Germany 5-4 to win bronze in the Tokyo Olympics. That is all we have in this evening news bulletin. Good night.